I was very fortunate to be invited to give a short talk at the annual EBMT meeting in Glasgow about the long-term complications associated with chronic graft-versus-host disease itself and its treatment, and then also to speak about the complex effects of this on a person's quality of life. Presence of chronic graft-versus-host disease increases the risk of severe or life-threatening conditions, and people who live with a wide range of chronic graft-versus-host disease complications experience quite significant physical impairments, poorer quality of life than their non-graft-versus-host disease counterparts, and general well-being issues. And it's important that we as health professionals, and especially as nurses, really understand the extent of the psychological toll to ensure that appropriate and timely mental health support is offered. As well as a higher reported incidence of depression and anxiety in these patients, they're also more susceptible to the financial toxicity that we associate with chronic conditions. Most employed patients work reduced hours or take leave, and a third of employed patients leave their jobs. They attend more appointments, often impacting on carer employment and other costs such as travel to hospital, parking and childcare. So while chronic graft-versus-host disease in of itself is complex, the burden of living with chronic graft-versus-host disease can be really overwhelming for many patients, causing significant life-changing impacts, even when the disease is relatively mild. The more educated and aware we can be, the better equipped we are to care.